Years since the World Health Organization declared COVID-19 a pandemic. Over 4 million people in Illinois have been infected with COVID. Over 36,000 of them have died from the virus. The public health emergency for the coronavirus is set to end in May, but it's something we continue to live with. And to talk with us about how far we have come and where exactly we're going, such as we know, is Dr. Katrine Wallace. She's an epidemiologist at UIC. Welcome back, Dr. Kat. Thanks so much for having us in your world again today.
Thank you for having me. Very happy to be here.
You know, sometimes I talk with friends and family, or we talk on the news, and sometimes I catch myself saying things like, you know, back when we had COVID, or now that we're past COVID. How do you frame where we're at?
So we've definitely we're in a very different place now than we were 3 years ago and even 2 years ago, right? We have more tools than ever to combat severe disease and death from COVID-19. We have the vaccine, which has saved millions of lives. And now we also have a bivalent booster that, unfortunately, not enough Chicagoans have gotten it, but it really does make a difference. And we also have antiviral medicines like Paxlovid to treat mild to moderate cases of COVID in those 12 and older. And in addition to those things, we also have a number of people who've had one or maybe more infections. So we have some population immunity as well on top of all that. So we are in a much better place than we were before, certainly. And moving forward, it is something we will continue to live with.
So if we say we're past COVID, is that right or wrong?
It's right in the sense that the public health emergency portion of COVID is over, but the COVID disease we will continue to live with. And that's why it's really important that we stay up to date with our vaccines. And when we do test positive, we do, call our healthcare provider, get on an antiviral medication, because there are tools we have now to prevent severe disease and death from COVID.
So many new vocabulary words entered our lexicon here. Variant, a word we didn't use a lot. We learned company names like Moderna. But one of the big ones we learned was Omicron. That was the variant that really kind of dominated the big spike, at least in our area. What's the variant right now that's kind of front and center?
So the good news is that we are still in Omicron.
Okay.
So all of the variants that we've had in the past, 13 months or so, have all been Omicron variants. So right now we have XBB.1.5, which is the latest in the Omicron variants. It's really about 90% of our cases in Chicago and also nationally. And this actually is the most contagious variant we have seen. And no other variant has really been able to compete with it. So this one seems to be getting people who have not had COVID yet, including me. And we are in a very different place, as I mentioned, even though this variant is very contagious. And is tending to get those people that even are really, really careful. We do have tools now that will help us.
I want to go back to something you said about the bivalent variant, the bivalent booster, and how so many Chicagoans have not gotten it. Is this kind of one of those catch-22s? Things are getting better, so people are taking their foot off the gas, but we can't take our foot off the gas to ensure that we're going to remain on this trajectory. How do you best sell to maybe somebody who's a little skeptical, a little dubious, who feel like this thing is fully in the rearview mirror, I don't need to get it? What's the best sell to convince people to actually do it?
Yeah, well, so this fall in September, we had our first update to the vaccine since the beginning. So the vaccine started rolling out in December of 2020 to healthcare workers and high-risk people. And we haven't had a new version of that vaccine until past September of 2022. And this one is targeted towards the Omicron variant. And for some reason, citywide, only 22% have gotten it. And those that are over 65, only about 41% of Chicagoans over 65 have gotten it. And this is the group that's really at high risk for severe disease and death and really needs to get that bivalent booster and stay up to date with their vaccines.
Final thing before we let you go, Governor Pritzker and the Illinois Department of Public Health yesterday announced they're launching a program to distribute over 60,000 purifiers to Illinois schools to help reduce, I guess, the spread of respiratory viruses. What's the importance of having these in schools exactly?
So this is very exciting because we've often said as public health people that we need to make our indoor air as healthy as our outdoor air with respect to ventilation to mitigate respiratory viruses in schools. So, and workplaces and such. But the IDPH and the Illinois State Board of Education are going to distribute more than 60,000 HEPA filters to schools. There are some qualifications they need to meet, like they have to be kind of lower income communities or have a high air pollution count. But this should be about 3,000 school districts statewide.
So it's huge, a big step forward for those groups who want to get the air as clean inside as outside. Dr. Katrine Wallace, thank you today and every day that you've helped walk us through all of these murky waters. Really appreciate it. Happy St. Patrick's Day.
Thank you so much for having me.
All right. Later